Now, good afternoon and welcome to our Tell Me About lecture entitled Promoting a Childcare Centred Approach to Healthcare. Today's lecture is being presented by Professor Imelda Coyne from Trinity College Dublin. Imelda is a professor in children's nursing and director of the Trinity Research in Childhood Centre, Trinity College Dublin. She's a fellow of Trinity College Dublin, fellow of the American Academy of Nursing, and a fellow of the European Academy of Nursing Science. She is the editor-in-chief for the International Journal of Adolescent Medicine and Health and a member of the Nursing Children and Young People editorial board. Her research focuses on promoting a child-centred care approach in healthcare through research on children and adolescents' participation in decision-making, co-designed interventions for children with long-term conditions, child and family-centred care, and supporting young people's transition to adult healthcare services. She has undertaken policy-relevant research for several government bodies and currently working on the development of a national transition standards in Ireland. Her research has led to the creation and co-design of a website and resources, steppingup.ie, to prepare youth for transition, which won Best Hospital Project Award. Her current research focuses on interventions to promote adolescents' communication and engagement in healthcare encounters. Imelda, we're delighted to have you here today and we're looking forward to hearing your presentation.
Thank you very much, Jenny, and to all who are attending remotely and to those who are present. My talk today is about promoting a child-centred care approach in healthcare, and I'm going to set it within the policy background, which is, sorry, Jenny, it just doesn't seem to be moving the presentation. With the, yeah. Our buttons are not moving. Okay. So the WHO in 2002 talked about making a world fit for children and about how we need to change a lot of ways in how we think about children and how we approach children, that there's a lot to be done. Everybody's very familiar with the United Nations Convention on the Rights of the Child, which says that, state parties shall assure to the child who's capable of forming his or her own views the rights to express those views freely in all matters affecting the child, and that the views of the child is given due weight in accordance with the age and maturity of the child. And that's been around for many years. 1989 was when it was established. And since then, there's been lots of other reports, and the Council of Europe Strategy for the Rights of the Child reiterated the UNCRC principle, but also extended it by saying that that individuals or groups of individuals having the rights, the means, the space, the opportunity, and where necessary, the support to freely express their views, to be heard, and to contribute to decision-making on matters affecting them. So that kind of moves it on a bit to say, there's a responsibility on us as healthcare workers and individuals to provide children with the means, the space, the opportunity, and the support. That's an important issue, and I will elaborate on that as we go through this talk today. So in Ireland, we're considered to be doing very well with regards to promoting children's participation and respecting children's rights. And we have the Better Outcomes, Brighter Futures report, was the national strategy established here in Ireland. Come on in. And the vision in this strategy was for Ireland to be one of the best small countries in which to grow up and raise a family, and where the rights of all children and young people are respected, protected, and fulfilled, and where their voices are heard, and where they're supported to realize their maximum potential now and in the future. So the Better Outcomes, Brighter Futures strategy was very groundbreaking when it was established back in 2014. And since then, the government has done a lot in this area to try and promote the rights of children. So they also developed a national strategy on children's and young people's participation in decision-making, and it was established in 2015. And in this strategy, they talk about how children and young people will have a voice in decisions that affect their health and well-being, including their views on health and social services delivered to them. And Ireland was one of the very first countries to actually establish a national strategy about children and young people's participation in decision-making. And since then, they've been working very hard in Hubna Nog and other government bodies to try and implement this policy right across health, education, welfare, because it has a broad application. But today I'm actually talking about its application in healthcare. So what do we know from the evidence in this area? Well, we know, and from all the reports and policies, that children have a right to be heard, to receive information, to participate in their care, to participate in decisions, to actually make decisions, not just participate in them, to make decisions, and that they should have the opportunity, the space, and the means. What do we know about children's preferences? Well, there's the research that's been done with children worldwide. Children talked about, wanting to express their views and to be heard. They wanted to participate in communication exchanges between healthcare staff and their carers or their parents. And they wanted to voice their preferences and needs, like how would I prefer this care to be delivered to me and what do I need? So very much about, conveying what they think about what's happening to them and what they would prefer, and trying to get those preferences accommodated as much as possible, and to be included in decisions and choices about their care and treatment. So how are we doing in this area? Well, just before we move on to that, let's look at the benefits of participation. The research in this area shows that, if you share information with children, they need information in order to understand what is happening to them. So if you share information with them, then they can be more involved in the decision. So if the decision is to put in an IV line and, this is information that's shared beforehand, it may cause distress, but there is ways of preparing the child that would reduce that stress when it actually happens. And if they're more involved in decisions, there is research which shows that they have an enhanced internal locus of control. So the child feels more in control of what's happening to them. And that leads to reduced stress and distress, and it actually enhances their feelings of self-efficacy. So the self-efficacy, what we mean by this, for those who perhaps not in this area of healthcare, is, it's around feeling confident in their abilities to handle the situation. That makes them more confident then to seek information, which then has another circular effect. So those are the benefits to participation. If we look at the effects of non-inclusion, well, children have talked about lacking information, not being communicated with, and not really being involved, and how it made them feel very confused. And there are situations today which still happen, which is very striking, that children can be brought for procedures and they don't even know they're going to undergo those procedures. And that's irrespective of their age. Sometimes people, carers and healthcare staff might think, well, it's better to maybe not give as much information because then they'll get too upset. But there are ways of giving the information which they can tolerate, and it can actually help them. And I'll show you that later. But they end up feeling quite kind of confused. They feel unprepared for what's happening. that makes them feel more fearful and anxious and causes distress. And then they talked about how, you know, when they felt they weren't included or didn't know what was happening, they felt lost, lonely, sad, and ignored. And that led to reduced self-esteem. So they feel they're not important. It's not, you know, I'm not the important person here, even though it's happening to me. And that has an effect of silencing them further. And, you know, there is research in this area which shows that adults can find it difficult to communicate their needs in healthcare settings. So you can imagine how doubly hard it is for children, because they have a much more powerless position to intervene and say, hang on a minute here, I don't understand what's happening. I mean, it requires an awful lot of courage to interrupt adults, and children are socialized to not interrupt adults and to stay quiet. You know, often parents might say, you know, don't bother the doctor, stay quiet, you know, because they might have questions as well, or, you know, this is not the time, or whatever. So there is that culture there. So, you know, I remember I thought it was interesting. Somebody said to me one time that, you know, some children enjoy being in hospital. Well, it hasn't been my experience as a children's nurse for many years, because hospitals are strange places. And there is a ton of research in this area looking at children's experiences. And children talked about an unfamiliar environment, unfamiliar faces, the unknown, feeling unsafe, disliking pain, needles, fearing mutilation and operations, even though they might be in for a medical care. They might think they're going to have an operation. Immobility, restricted movement, restricted activity. Some units have locked doors because of security reasons, but even if they don't have locked doors, there's rules and regulations about moving away from their bed, and so they're generally very restricted movement and restricted contact, usually contact with just the parents or carers. And that worsened during COVID because of infection control. They needed to reduce the amount of people that were coming through the hospital. But some units haven't relaxed those rules and don't allow as many people to be present. Inadequate play facilities, lack of toys, resources, lack of access to play, inconsistent access to play, allowed to, you know, have go to the playroom at certain times, not at other times. Children talked about where a game would be put down in front of them and they're expected to play the game, when play should be very spontaneous. Some that it was, you know, it's an optional extra rather than an essential part of children's care. They also talked about a loss of autonomy, a loss of control, a loss of participation in decisions, a loss of choices, not being given choices. But, you know, there is research in this area which shows that there are healthcare staff, particularly nurses, who are very good at giving children choices. And when they give children choices, the children feel like they have more control and they feel respected. And even if they're small choices like, can I take your blood pressure on this arm rather than the other arm? Because some children fear having their blood pressure taken. Or if they're, you know, due to have a bath or a wash, will we do it now or will we do it later? It's these everyday choices that matter to children. They also talked about wards being very hot and stuffy, bright lights on all the time, very noisy at night time. They felt very distressed when they heard other children crying, and they wondered what was being done to them and feared that it might be done to them as well. And many of the older children talked about how the ward decor didn't really make them feel welcomed because it was all cartoon characters. They also talked about separation from family, and also contact with their friends and peers. And friends and peers are very important, and yet they're often not allowed into a hospital setting. loss of routine, missing school. So even if they attended a school in the hospital, it wasn't the same. Missing sporting activities, their social activities, and a total disruption. So if we set the scene that this is how children experience hospitalization, and, you know, this is across different children who've reported different issues. So it's not the same for all children, needless to say, but at the same time, it is not an easy experience to be hospitalized and then to be kind of not included. These are just two quotes from two children who's, when I asked them, like, how did you feel? One boy said, I felt real disappointed. I felt kind of rejected in a way. A girl, age 14, said, it made me feel a bit like a piece of machinery. Actually, they weren't actually talking to me. I thought, hey, I'm the patient here. Talk to me, explain what you're going to do. The other kind of feelings that younger children said, you know, disappointed, sad, confused, angry, rotten, worried, misled, shocked, betrayed, lonely, and ignored. So these were a range of feelings that children expressed about not being included, not being heard, not feeling that they knew what was going on, that they weren't allowed to have, you know, say what they thought. Just this feeling of not being important, really, in the scheme of things. So what I'm talking today about is about promoting a child-centered care approach. And, you know, we have been talking about this a long time, but we've had family-centered care as the dominant paradigm. And family-centered care is extremely important. But sometimes with the emphasis on family, it's usually the emphasis on the parents and how the parents are coping and what can be done to help the parents during this hospitalization. And I'm not saying that's not important, that is. But sometimes we lose sight of the child. It's about the child, and the child is here in hospital because they're ill. So if we talk about having a child-centered care approach, we're talking about incorporating the rights of the child that I mentioned earlier, the UNCRC, and other policies that children have the right to participate in all aspects of healthcare delivery in conjunction with the needs of their family. It is also about considering each child's preferences, values, family situations, social circumstances, seeing the child as an individual and working together with the family to provide appropriate care. In some countries, children, like in the Netherlands in particular, children aged 16 and above can consent to research and to treatment without the parents co-signing or agreeing. But in other countries, like here, 0 to 18, parents, you know, have to give consent most of the time. So there is that kind of feeling that children are kind of clumped together. But if we think about adolescents, they're learning to be independent. They're learning to express their needs and preferences and things like that. So when they come into hospital, they might feel like, you know, it's kind of, they're going backwards because, you know, suddenly they're not, this is not being talked through with them, and the parents are kind of taking the lead in decisions about their care. So we also know, I also would say that services need to be flexible. So it's not just what you can do as a nurse, but that the services need to be more flexible in meeting children's needs in a manner that's best for them. And this involves working with children and their families to find the best way to provide their care. So how can we promote child-centered care? And I've developed this model called the RESPECT model, which is our respecting the child in the first place, encouraging them, providing space, eliciting their preferences, and engaging them in what's happening, and communicating with them and establishing trust. Now, these are all kind of interrelated, because if you approach a child and you communicate with them and you give them time and space, and you talk to them about, you know, what's happening, and you ask them their preferences, then you are kind of establishing a trust there. And so they trust that, you know, you want the best for them, and that you are a healthcare professional that really thinks about them and will listen to them and hear them out. Time and time again, they have looked at the importance of time and space. By space, meaning that children cannot be rushed. We think at a much quicker pace than children. So when you're trying to actually explain things, sometimes you have to come back and explain it again, because you have to gear it to the child's literacy level and developmental stage. And then you have to think about, well, how much did the child actually understand? Because children have different developmental levels. So even you had two children, 9 years of age, one might have a better understanding than another. So they often say that it's good to get the child to repeat back what you've said. Like, so what do you think that means for you? Can you tell me in your own words? Or what do you think is going to happen? Can you tell me what you understand? And if they say, well, I'm going to have that operation and my foot cut off, you think, oh no, I'll have to start again. So you kind of, you know, work from that base. So it's about giving them the space to have time to discuss it back and forward, and also not to feel rushed into, you know, making a decision or making a choice. And there are many daily decisions that children make in the hospital setting. And when children were asked about all those decisions, these are not treatment decisions necessarily, like, are you going to have that operation or not? Are you going to have that procedure or not? It was more everyday decisions in the hospital, you know, when they were going to have some, care administered to them, choices over maybe what was going to happen to them during the day, like when they went to the playroom, when they went to, for different procedures and things like that. Those daily care decisions were the ones that they really valued and really liked. And sorry, Jenny, do we have to press a button again? So our system is playing up on us. So how can we support and strengthen children's participation? Well, there are ways of doing this, and like I've spoken about, providing children with the means, the space, the opportunity, and the support. And the means, I will move on to that after this slide and talk about what means can you use. It also requires the adult to include the child's perspective in all their actions and care delivery. And it also means that care needs to be sensitive and supportive of children's actions and expressions, because through children's expressions, we can understand how they feel. Maria Harder in Sweden did a lot of work with children aged 3 to 5, and also Regitze Pals and Angela Quay and Anna Stolberg. These are all Swedish students who were PhD students, and they looked at children as young as 3 to 5 in some of these studies, and they were able to communicate their health and treatment needs as well as their preferences. And like that is moving the evidence forward, because a lot of people feel that it's when a child is around maybe 9 or 10 that you could actually start discussing things with them and including them. But they were able to show through videos and of healthcare encounters how children were able to convey their views and preferences and manage a healthcare situation. And Anna Stolberg developed an app where the child creates their own avatar, and then the avatar goes to meet the doctor and has their heart rate looked at and their ears looked at. And that's all on this app. And the child does it and brings the tablet with them into the consultation, and they can express their preferences through the avatar as to where they want to sit and what they want to happen. And she found that children were much happier when they were able to use this app to convey their views and experiences. And children are very technological nowadays. So that's how, you know, if we think about how do we give them the means to communicate, we need to think around technology. Then, is this going to, yeah. So like I said, the ways of involvement are very important to children. And we can also use play to explain things and to reduce the adverse effects of hospitalisation. And play does tend to be sometimes underutilized. It can be very therapeutic in how we use play. What is the other evidence that's in this area around play and other means of trying to communicate with children? Well, these are systematic reviews, and systematic reviews, for those who might not be familiar with this research terminology, it's where you pull together a lot of studies in that area, and you kind of work out what was the key message from these studies. So what is this evidence telling you? And Gillarde, I hope I'm pronouncing that right, it's a Dutch name, in 2021 reviewed 297 studies, so that's quite a lot, and showed definitively, the evidence from those studies showed definitively that play interventions had a positive effect on children's pain, stress, and anxiety. So, you know, that's strong evidence there. So you would expect that play is used a lot, but sometimes play is not used to explain things to children as much as it could be. Other reviews that were done in the area of cancer care by Scott, Ranmel, and myself found that computer-assisted education programs, educational video games, art therapy, play, and storytelling were quite good at helping children understand and cope with what was happening to them. There's also evidence supporting the efficacy of distraction, hypnosis, combined cognitive behavioral therapy, and breathing interventions for reducing children's needle-related pain or distress, or both. And that was from 59 randomized controlled trials. So that's quite strong evidence again. There's also the efficacy of virtual reality in managing procedure pain and anxiety, and that was from 77 studies. But virtual reality is not used as much as it could be, but that is the future. That is what we could do. And there are work being done in some hospitals in the US where they have the whole process is virtual reality, and the child puts on the virtual reality goggles, and then they're walked through the whole process, and then they talk about it afterwards. And then this is all before they actually have to undergo the process, whether it's an MRI or whatever. So it's a great way of actually explaining things and helping the child to understand what's happening. Holzit et al. Looked at 18 studies that were all randomized controlled trials and concluded that serious games can improve children's coping and health outcomes. And I examined a PhD recently, which was done in Sweden, and it looked at a serious game to help children cope with having radiological treatment. And it had quite a good influence on the children going through the process. So they played the game beforehand, and further work is going to go into modifying and extending game. But they're called serious games because they prepare children. So we also know that role and prop play, and this is stuff that play therapists do, play specialists do every day of the week in hospitals, helps with communication, revealing feelings, and reducing fear and anxiety. And I had another PhD student who looked at children, you know, who had diabetes, and they were playing with toys and they were stabbing the the doll with a needle and saying, you will have to have your insulin. And she was able to observe how they were behaving, you know, in order to kind of see what were their feelings about receiving this care. So roll and prop pay can have a very good effect as well. And it can help lead to them being more satisfied with their care and improved nurse-child relationship. Like I mentioned, virtual reality interventions, there are studies done in this area which showed that they help prepare children for medical procedures, that it helps them obtain knowledge on procedures, and that they overcome their fear of needles. And we also have pet therapy, which is now been shown by other studies effective for relieving pain and controlling blood pressure, decreasing anxiety in children while promoting parent satisfaction and facilitating children's engagement, enjoyment and motivation. And pet therapy could be used an awful lot more. And children are very close to their pets. And often if you talk to children in hospital, the conversation will start very easy if they talk about their pets and they miss them. So I think pets should be allowed into hospitals as much as possible. I mean, they allow pets to travel everywhere on airplanes now, so why can't we allow them into hospitals? But they do have pets visiting children in hospital where they bring rabbits and cats and dogs and things like that. Wouldn't it be nice if they could have their own cat or dog, you know, to come and visit them in the hospital? So in conclusion, I'd like to end, and that this was in the title of my talk, which is Somewhere Over the Rainbow. And that is that children often want to escape their surroundings and go to a place where they have greater powers and opportunities. And they want to go to a land where they are respected. And I'll just see, will I be able to play Judy Garland? No, it's not going to do it for me. I had embedded it in it, but it's not coming up. It might be the sound, is it? Yeah, there. Oh. Yeah, I just clicked.
Somewhere over the rainbow, way up, there's a land that I heard of once in a lullaby. Somewhere over the rainbow, skies are blue, and the dreams that you dare to dream really do come true. Someday I'll wish upon a star and wake up where the clouds are far behind, where troubles melt like lemon drops away above the chimney tops. That's where you'll be. Somewhere over the rainbow, smile over the rainbow. Why, oh, why can't I?
So in the conclusion, if we want a world fit for children, we need to support their right to full and meaningful participation. These words here actually were said by children that were consulted for that by the World Health Organization, not consulted, but involved in drafting the document. And in their own words, they said, we have a right to full and meaningful participation. We should be actively involved in decision-making at every level. And we're not the sources of problems, we are the resources that are needed to solve them. We're not expenses, we're investments. We're not just young people, we're people and citizens of this world. You call us the future, where we're also the present. Thank you for listening, and apologies for all the IT.
Thank you very much, Imelda. That was a fascinating presentation, and thank you for sharing your research with us. I have a couple of comments from the online viewers, and we also have a question from the audience. The first comment and question is from Julie Spray. Thank you, Imelda. I love your work and so enjoyed your presentation, especially the practical approaches, which remind me that approaches that work for children are often what we should also be doing for adults too. Children are human, and good, accessible practices for children are often good for all humans. I wonder if you had any thoughts on what children might be teaching us about what humans need. How might adults also benefit from things we've learned are helpful for children, at least if we weren't so adultist and scared of looking childish?
Well, that's a really good question, Julie, and I'm not even sure I can answer it properly. As to what children could teach us, well, I think children could teach us how to be playful and how to see the positive in things, because, you know, if you care for children in hospital, they can be so sick and so unwell, and they're still smiling and, you know, playing and doing things that they normally do with all the various drips and things attached to them. So I think as adults, we could be a lot more playful. I suppose the other thing is that, you know, we use different ways of researching with children that are participatory techniques with children in order to try and discern their views. And we often don't use those with adults, and adults could actually respond quite well to those. And I remember in one study, we had a sorting exercise for the children where we sorted cards, and there was statements was written on them to ask the children what was the most important of all these statements. And the statements were the words of the children from the project. But we decided to use it with the adults, and at first they started laughing, these are the doctors and nurses, and then they took it seriously, and then they started moving things around and prioritizing it. And we realized that, you know, sometimes things that we work with children to help children to communicate, to help children participate, they could be used with adults, because we have a lot of research out there which shows that adults, particularly the elderly, do not have their views heard as well. So there's that conception they're old, they don't understand, you know, they don't need to know whatever, that they have cancer or whatever. So those are lessons that could be applied across to adult care.
Thank you, Imelda. We have a question now from the room.
Thank you, Janine. Thank you, Imelda, for a very fascinating presentation. I'm a nurse and also a lecturer in the Faculty of Nursing, but I came from Indonesia, and I feel so delighted that you say that Ireland is one of the countries that start very early about having this child-centered care in the healthcare system. It's really good. But based on my experience and what I can see now in my country, which is one of developing country at the moment, we really have very limited resources in the hospital. Even like many nurses, like for example, want to let the child have an options for like an everyday options actually, but they just feel that by giving them an options, it makes their job more hard to do because it will need more time, and then while they have so many things that I have to do. So I'm thinking about what should we do, like for example, in my country, to start the very first study that we can do just to make a little change. Maybe there is something that we can do, even though it will not change all the regulations, but maybe by doing something at the first step, then maybe it can be a first study that will be followed by the others, and then make a change. with the regulation, and these children can allow, we can have a more child-centered care even in the hospital. And in my country, for children, we have a regulation that for even for siblings, not only for friends, they will not be allowed to visit their siblings in the hospital unless they are 12 years old and more. So many things actually to change. Thank you.
Many things. It's very hard to know where to start, Aoife, and you're right, because, you know, okay, it's not ideal in many countries, and in the World Fit for Children, the WHO report, you know, they talked about children still experiencing wars, hardship, poverty, you know, and the hospital situation it's not good. And then you have hospitals with not very good resources and not many staff. And if they have staff, they're probably not educated to care for children. They're educated in a general system. So there are a lot of obstacles and a lot of challenges. So I would say the first main thing that could be done is to try and educate healthcare staff about the adverse impact on children, so that if they even did one change in their day, which is, you know, to ask a child, you know, can you tell me what it's like for you being here or something, that would give them insight into the children's experiences. So if there was just one thing that they could change in the day, but I would start from a system level with education and raising awareness that, you know, children must be seen and must be heard, and that helps them, and that they're, I didn't go into it because we don't have forever, but you know, children who were in hospital years ago, when they became elderly, there were research by somebody in the UK, and they could vividly recall what it was like for them in hospital. So we tend to assume that children will overcome and forget these experiences, and they don't. So I think it's raising awareness is the first step in countries that don't have an ethos of involving children, and then establishing guidelines, and then changing your practice in a day by day. Just start small, and, you know, children really value that, really value. Thanks for your question.
Yeah, Imelda, we've two more online, so if we can just address those. Oh, three more now. So Lisa Kerwin, fantastic work and brilliant presentation, Imelda. So important that we give children the opportunity to have their voices heard, and most importantly, listen to what they have to say. I'm just wondering, has there been any research done on parents or caregivers' perspectives on child-centred care? Child-centred care is ideal and what we all strive to achieve in clinical practice, but I find it can be difficult to involve children in their care when parents or caregivers aren't on board, or sometimes this care is dictated by them. What are your thoughts on this?
Oh, another good question, and a difficult one to answer, because yes, you're right, Lisa. It can be very challenging because parents need their awareness raising as well. And some parents, I mean, parenting is changing over time, and it continues to change. Like in my day, it was children should be seen and not heard.
Yeah.
And I'm not that old. But so that, you know, 30 or 40 years at the UNCRC, and we're only now seeing these changes. So change is slow. So sometimes parents need their awareness raising of the importance of including their child. And this is where healthcare staff can play a good role, because they can say to the parent, should we hear what, you know, Rebecca thinks about this, and they might say, well, look, I don't want my child to know. Then you have to do that work with the parent. And with regards to research in this area, yes, there is research in this area which reports mixed views, which is you will have some parents that are very encouraging, very supportive, discuss everything with a child in the home setting with regards to any decisions around food, traveling, holidays, and then they carry that through into the hospital setting. So they are very on board with this. But then you have parents who maybe grew up in a certain household where they were seen and not heard, and they believe that children's place is to be quiet and that they take the lead. And that's where you have to do work with those parents to try and show them. And parents are very amenable to change. So, you know, one of the studies I did with parents, they turned around and said, "Do you know, it's great in healthcare nowadays. The doctor actually talked to my daughter and asked her what did she think." I was astounded. But you know, that's the thing. That's what's happening now. You know, that he made a good attempt to talk to my child, and lots of parents said that. You know, the doctor and the nurse were trying to talk to my child, trying to explain things in very simple language, and I was really impressed. So I would say that change is slow, but that parents are moving quickly in that area, and very much about, you know, it's being fed through from an educational perspective in schools about the importance of listening to children. And so, you know, parents will get on board.
One more question and one more comment. The question is probably slightly linked to the previous. It's from Paulina. I am not,
Oh,
apologies.
Paulina Duarte.
Yeah, thank you. I wasn't going to butcher her
Hi,
surname.
Paulina.
Thank you very much. I wonder how all the research which focuses on children's perspectives regarding hospitalisation is translated into the training and education of healthcare professionals. So that kind of leads on.
To say, how is it translated?
Yes. So how all the research which focuses on children's perspectives regarding hospitalisation is translated into the training and education of healthcare professionals.
Well, Paulina, it is, well, it's translated at undergrad level in that we have a lot of teaching on children's rights, children's views on hospitalisation, children's experiences of participation. So that's taught at undergrad and postgrad level. You do have in-service training days in hospitals, well, here in Ireland, where you have, you know, different talks on different things. So, I mean, that's the only way I can see how it is delivered is, you know, through undergrad programs and through postgrad, and also through in-service days, and a commitment at hospital level. I remember when I worked in Great Ormond Street years ago, they had a sign over the door, "The child first and foremost." And I remember thinking as a nurse, isn't that a bit obvious? Why are they saying that? We're a children's hospital, totally. You know, there's no adults here. And but now I realize the importance of it is keep the focus on the child. And I think if there's a commitment at hospital level in their policies, their standards, their evaluations, is how well are we doing? And a lot of hospitals are doing that now. They're evaluating the care from both the parents and the child's perspective.
And keeping the child at the centre. Paulina, just in relation to your comment there, I've passed your details on to our attendee here, and so I'm sure she'll make contact with you. And finally, we have just a comment from Jacqueline Whelan. Thank you as always for your expert insights into how we can best progress child-centred approaches to healthcare. Let's hope that pet therapy will come to the fore and be considered when the new children's hospital opens up to help children cope. You're here.
Absolutely, Jackie. And that would be a lovely job if I ever retired. I'd love to be bringing the pets in and out. Yeah, let's
your
hope.
retirement plan, pet therapy.
The new children's hospital, I did a tour of it. They have a beautiful roof garden. They have lots of space downstairs. They have an internal garden as well, and I think the ground floor. And I think they'll be very progressive with regards to those areas. Not exactly sure what their policy is on pets, but you know, as more evidence come out, we need to think about things broadly.
Well, I know myself, even with when you were talking about maybe the correlation between children and then older people and their voices not being heard, and it's something I've personal experience of. And the cats for my mum were the focus, you know, and the cat sat beside her. And he went to sleep and she rested. And so I think pets are very important to those who have them.
And they show that, you know, if you have a pet like a cat or a dog and you're, you know, stroking them, it actually reduces your blood pressure and reduces your stress and makes you feel just better in yourself.
Mm,
So yeah,
absolutely.
we've never done much with that with children. We just remove them from the home, give them a lot of unpleasant treatments and expect them to cope, you know, when there's, these are very
And
important.
get over it and leave it behind them.
Yeah,
Yeah.
yeah.
So,
Very-
Imelda, on behalf of the school's Civic Engagement Committee, I would again like to thank you so much for giving this lecture today. To all those online, apologies that we were a little late starting. We made allowance for it now, and this is being recorded and will be made available over the coming days. So thank you very much.
Thank you, Jenny. Thank you, everyone.